Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Do I have a broken or bruised bone? How to know for sure? The main difference between a fractured bone and a bone bruise is that a fracture results in an actual break in the bone and a bone bruise does not. However, the two have similar symptoms and causes, so it can be hard to tell if a bone is fractured or bruised without a physical examination and/or diagnostic testing, such as an X-ray or magnetic resonance imaging test. /r/n/r/n This article will discuss the symptoms of a fracture versus a bone bruise, how each is treated, and when to get emergency care. /r/n/r/n Images Getty Imagesrnrn A fracture occurs when a bone is damaged to the point where it cracks or breaks. Fractures are the same as broken bones. Fractures range from relatively minor, which include a hairline or stress fracture, to severe. An example of a serious fracture is a compound fracture where the bone may actually penetrate the skin. /r/n/r/n A fracture can be caused by an injury, osteoporosis, or repetitive stress on the bone, due to running or jumping, for example. /r/n/r/n Bone bruises can also be caused by trauma, injury, or osteoporosis, but instead of actually breaking, the bone gets several tiny cracks in it and blood and fluid build up under the skin. The most common areas for bone bruising to occur are the knee and ankle. /r/n/r/n A hairline fracture in particular may be difficult to distinguish from a bone bruise without an imaging test. More serious fractures typically have more obvious and severe symptoms and are less likely to be confused with a bone bruise. /r/n/r/n The symptoms of a fracture may vary depending on how severe it is and where it is located. Common symptoms of a fracture include /r/n/r/n Symptoms of a bone bruise can include /r/n/r/n Head to an urgent care clinic or an emergency room if /r/n/r/n/r/n/r/n When diagnosing a fracture or a bone bruise, your healthcare provider will start by asking you questions about how and when the injury occurred as well as your symptoms. They will then do a physical examination of the area, looking for swelling, bruising, and tenderness. /r/n/r/n Imaging tests are also helpful to differentiate a fracture and a bone bruise. An X-ray can reveal a fracture, but magnetic resonance imaging, MRI, is necessary to identify a bone bruise. /r/n/r/n If your healthcare provider suspects you have a more severe fracture or your symptoms are caused by another problem, additional testing may be necessary. /r/n/r/n Initial treatment for a minor fracture includes the RICE protocol, a method of self-care that you can do at home. RICE stands for /r/n/r/n Nonsteroidal anti-inflammatory medications, NSAIDs, like Advil, ibuprofen, and Aleve, naproxen sodium, may be helpful for relieving pain. However, these are not always recommended, as anything that stops the inflammatory process, which is the immune system's healing response, can slow down recovery. /r/n/r/n Certain types of stress fractures may require casting or, in the case of a foot or leg fracture, crutches. /r/n/r/n Healing time depends on the location and severity of a fracture. Typically, fractures take 6 to 8 weeks to heal. More serious fractures can take longer. /r/n/r/n Treatment for a bone bruise is comparable to treatment for a fracture. The RICE method is also recommended as the first-line treatment. As with fractures, you may be advised not to take NSAIDs, as some of these may delay normal bone healing. /r/n/r/n Your healthcare provider will tell you how long to avoid putting weight on the affected bone. Again, crutches may be necessary if the bruise affects your foot or leg. Most bone bruises heal within 4 to 8 weeks. /r/n/r/n A minor fracture, such as a stress fracture, can be hard to tell from a bone bruise because they cause similar symptoms, including swelling and pain. The main difference is that a fracture results in a break in the bone, while a bone bruise creates tiny cracks in the bone. Healthcare providers can tell the difference by using X-rays and MRIs. In most cases, bone bruises and fractures will heal within a month or two with conservative treatment. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.